ask questions as we go. Yeah.
Great.
Okay, so I'm gonna start this here. Okay. All right. Well, yeah. So as I said before, I'm Jinda. I go by Dr. Chai in my practice here in Seattle, and I'm a naturopathic doctor. I was interested in what will be happening with telehealth in the near future and how it also plays a role in social determinants of health. So I'm just gonna switch to the next slide. So just defining the difference between telemedicine and telehealth, they're very similar. Telemedicine is just kind of more specific to physicians and their patients, whereas telehealth can refer to providers talking to one another, or not necessarily physicians, but it could be therapists. It could be any other types of technology. So for instance, monitoring patients through like continuous blood glucose monitors or something like that. So that's just kind of the difference.
So, Jinda, I'm going to interrupt you for a second. Is everybody able to see Jinda's slides? Because I'm not.
Oh, you can't see the slide?
No, can you please share it again?
Oh, like the screen?
Yeah, your screen. Thank you.
Okay, how do I... Oh, am I not sharing the screen?
No, we are seeing your video right now.
Oh, okay, sorry. Let me make sure I'm sharing the right one. Okay, maybe I didn't click share.
This is perfect. Yeah,
You
thank
see it
you.
now? Okay. Okay, so yes, the two definitions, telemedicine versus telehealth. Okay. So a little history on telehealth. The first use of electronic communication for health reasons was during the Civil War with telegraphs to communicate casualty reports, coordinate patient transport, and request medical supplies. In 1905, Willem Einthoven, who happened to also be the inventor of the electrocardiogram, demonstrated the telecardiogram, of course, through transmission of heart sounds using the telephone. In 1959, there was the first widely reported use of interactive video communications at the University of Nebraska, where clinicians transmitted neurological exams across campus to medical students. And then several years later, they performed something similar between Norfolk State Hospital and the university for psychiatric and neurologic consultations. And I found a really cool photo of one of the professors at University of Nebraska kind of conducting this with, like, I don't know, a room full of film, tape, and everything. So I thought that was kind of cool. In the 1990s, these were known as the developmental years of telehealth because there were many federally funded grants that were given out for these programs. Ooh, I guess there's a little typo there. But goals were to improve specialty access to outpatient services and increasing access to care in rural areas. I know Alaska is a really big example. They do use telehealth a lot because they are limited in how many actual providers are there. In the 2000s, this was known as maturation of telehealth. So it was used in neurology to increase utilization of TPA, which was a new treatment for acute ischemic strokes. There's actually something called tele-ICU, which was apparently mostly used to monitor patients remotely. It also became a core strategy for chronic disease management and home care for veterans, and was also used and studied a lot in pediatrics, and was shown to have few medication errors and decreased costs of care. Okay. So then during telehealth and COVID-19, when the stay-at-home orders were put in place across the US, we just saw a skyrocket in telehealth. Before COVID-19, the University of Pittsburgh reported 75 to 100 virtual visits per day. And then at the outset of the public health emergency, visits increased to 400 visits per day through telehealth. Medicare had similar findings. After the stay-at-home orders were put in place, nearly half of primary care visits were telehealth, and prior to this, the number was less than. Basically showing the pandemic and stay-at-home orders were put in place. You'll also notice that a large amount of those visits were mental health and substance, as the rest, were other professions. I have some other really cool visualizations. I heard you guys talking about visualizations earlier, so I thought that some of these were nice. Not this one specifically, but more coming up. Okay. So then this is an article quoting the CDC saying that telehealth could have multiple benefits during the pandemic by expanding access to care, reducing disease exposure for staff and patients, preserving scarce supplies of personal protective equipment, and reducing patient demand on facilities. Of course, this was said basically in the beginning of the pandemic. So if you are in healthcare at all, then you would know that, of course, telehealth was very important, especially at the beginning of the pandemic. So this was taken by a article that was trying to think of the word right now. I can't think of it, but they surveyed physicians and patients. So basically the summary is that a majority of clinicians currently use telehealth, would love to continue to use it, felt like it provides quality care in many different situations. Patients also felt the same way for the most part. I did think that it was interesting that 8% of respondents, only 8% were using monitoring technologies, like I kind of said, like continuous glucose monitors and whatnot. I hope that those are utilized more in the future to monitor patients, but during the pandemic, I don't think that was the priority. And then a visualization, just a little cartoon from the American Hospital Association, reinforcing that we use a lot of telehealth. Many providers were happy with the results of telehealth, specifically in psychiatry as well, which we will see later on in this presentation. So these numbers here are from a nationally represented random survey of around 3,000 households between July 1st and August 3rd, 2020. 50% of households reported using telehealth because they could not receive medical care in person. Basically, the numbers were lower in rural than urban areas, and then also in populations with lower earning households. So that's kind of what all of this says here. And we will learn more about why that is. Another survey that was conducted in April, so about a year later, April 2021 to October 2021, just some more kind of interesting numbers that higher proportions of telehealth visits were between patients ages 18 through 24, college graduates, patients who had private health insurance. And then on the bottom here, the share of telehealth visits by video were lower, meaning that share by audio was highest, which I actually didn't realize doctors were doing audio-only visits, because I guess I haven't been. But among those without a high school diploma as well, and adults age 65 and older. So later on, we'll learn that this is called the digital divide, where there are just certain populations that don't have as much access to telehealth for various reasons. Here's a quote from the Committee for a Responsible Federal Budget regarding fiscal concerns of telemedicine. The summary here is basically that maybe it'll be overutilized because it's a lot easier to conduct a telehealth visit. There may be provider incentives because these visits are easier to conduct, or maybe like the coding will be the same since we can code based on time, and it would be reimbursed the same as an in-person. Although I feel like there could always be provider incentive issues, which is why we have insurance to audit those charts. And then fraud and abuse, which has actually become, I think, a legitimate issue with telehealth. So that is something to look out for this will probably continue to some degree, the telehealth, I mean. So the special case of mental health coverage, another quote from the Committee for Responsible Federal Budget. For the President's federal year 2023 budget, it will extend Medicare coverage of tele and addiction medicine through telehealth more than any other sector of medicine. So there's going to be probably more continued coverage in the mental health care field, which makes a lot of sense. Here was one of those visualizations from the Kaiser Family Foundation. The math here kind of doesn't really make a lot of sense to me, and they didn't explain it very well in their article. The reason why I feel like they added it in this article, and the reason why I also included it was just to highlight that mental health and substance use disorder was utilized a lot more in rural places than urban places, which is interesting because you actually, in general, just find that rural places do not, or rural populations do not use telehealth quite as much in general with other sectors of medicine, basically. So I thought that was the most interesting part of this visualization. So it's probably my favorite one, just showing that there was variation in the share of telehealth claims across specialties. So again, psychiatry was highest here, substance use disorder was second, and then you can kind of see all the other specialties that utilize telehealth. This is a quote here, just stating from the CDC that telehealth could be used to provide more access for rural healthcare facilities to specialists and subspecialists within these specific specialties here in medicine. An interesting realm of medicine that I thought I would share that I learned about was telestroke medicine, since many rural hospitals do not have doctors who specialize in stroke care on site. So they do use telehealth to consult with other doctors or neurosurgeons and radiologists to ensure that patients receive a fast diagnosis and appropriate treatment. So just kind of switching over into the digital divide piece in this survey. So when doctors were answered what was a barrier to telemedicine for patients, number one answer was limited patient access to technology. The second was limited digital literacy and limited patient access to broadband internet. So in the next few slides, I'll be focusing mostly on the digital literacy and access to broadband internet.
Dr. Chai, a question?
Yeah.
This is interesting data. I'm curious, especially before we get too much into the digital divide info, if you came across data that clearly we had a reduction in healthcare visits through the pandemic, in-person visits, and we had an increase in telehealth visits, but on net, I'm assuming it's still a reduction in visits.
On what was that last word that you had said?
So on balance, in total, I'm assuming that still there's been an overall reduction in healthcare engagements, that the increase in telehealth visits hasn't overcome the overall reduction in face-to-face visits.
Oh, I see. Yeah, that's a good question. I'd have to, look up total number of healthcare visits overall before the pandemic, and then maybe, after like a year ago or maybe now. I don't think they have the data now, but is that what you're asking? Like if the total number of healthcare visits is at this point when they're doing the study less than before?
Yeah, telehealth clearly made up for some of it, but I don't think it made up for a lot of it through the pandemic. Yeah, I was just curious if you came across any data that would suggest what portion of kind of the pandemic hit to healthcare visits did telehealth help overcome?
Oh, okay. So
Yeah, I can make a comment about that. So for example, when I analyze data for our own cancer center, during the peak of the COVID pandemic, anything that was discretionary was kind of postponed. So any elective surgeries or even some preventive work was postponed. So overall number of visits did decrease. I did, for example, analyze data on mammograms and things like that. And a lot of those visits did not happen. So I'm pretty sure overall the number of visits did decrease.
Thank you.
And then I was just wondering if that is related to this visualization, or if you were just wondering that before we move on, so that we have like context kind of.
Yeah, just before we move on. Yeah.
Okay.
Thank you.
Yeah, that's a great question. Okay. So I'm just going to go to the next slide. So I won't lie, I found many articles that were, or I would look at some of the actual studies. I wasn't super happy with always with like how things were, like the terminology of things, but this was kind of maybe one of the better articles that I found so far that quoted another study anyway. So basically the point here saying that this study by the Journal of Racial and Ethnic Health Disparities revealed a digital divide with like older populations, as well as certain participants who were older. I mean, it says here less educated, economically disadvantaged, and from ethnic groups. And they were 5 times less likely to have access to digital health than those who were younger or more highly educated, higher income, or were European Americans. So yeah, just kind of wanted to, there are many articles that looks like someone's entering the chat. I'll just admit them. But yeah, so many articles that basically state the same thing here. So something else that I came across was the topic of broadband internet, and how that is a kind of it is like, a social determinant of health. We were even talking about how it's Jamie, correct? You guys were on like your slower internet, and then we couldn't talk to you guys. So I thought that was something that was interesting. And so I'm just gonna leave. Is it working where I'm like leaving the PowerPoint for a second?
Yes, it's working.
Okay, so just a nice map here, visualization. Ooh, of broadband internet availability throughout the US. So you can kind of see like which areas have good access and not as good access. So if you get this PowerPoint, you'll be able to click on that and see who has a good connection to internet or not. So the definition of broadband high-speed internet access that is always on and faster than traditional dial-up. So that could include DSL, cable, satellite, wireless, and fiber optic. So broadband as a social determinant of health. This is an article by the American Medical Informatics Association showing that poor broadband, limited patient portal adoption. Well, this was actually done in 2017, just with patients signing up for their patient portals. So 4 key barriers limiting broadband access at that time was the broadband subscription cost, the device such as the digital router. Some patients didn't feel like they needed it, and also low digital health literacy in some of those areas. That was in North Carolina. So how do we improve high-speed internet access, or what steps has the government taken to do this? So several states have already increased internet speed requirements. The federal government has been funding the expansion of the Telecommunications Act of 1996 to amend the definition of universal service to include high-speed internet. The FCC, which is the Federal Communications Commission, has established a universal service fund to increase availability of high-speed internet to rural and low-income communities. The CARES Act and Consolidated Appropriation Act allocated $125 million and $7.5 billion for broadband expansion. ARPA, which is the American Rescue Plan Act, is also shifting guidelines to limited expansion areas that don't have reliable service as well. And state governments have provided grants and loans to internet service providers and local governments prior to COVID. Currently, all but 3 states have agencies involved in expansion. So the government is trying to do things to expand internet access, basically. For health, sorry, I have this written down here. It keeps going away, my notes. But oh, here we go. So mostly resources for organizations to improve digital health literacy for their clients or patients, whoever's coming through. So I was just gonna click on some of these websites here to just show you what they look like. Yeah, but honestly, it was kind of like, how do you create your website to be more digitally literate? Or, I mean, I kind of liked this article the most. So, I mean, I think you guys get the PowerPoint, so you can kind of read through the articles. But I thought that this was kind of a nice article just for the general person to read. But yeah, so, but then on that note, I did find an article on how Nemours Hospital did address one aspect of the digital divide during the pandemic. So while there were some staffers whose jobs no longer existed, they made it where their job was to get the patient and their family ready for their telehealth visit. So there were digital navigators who were in the patient's waiting room, who helped them work through digital forms, troubleshooting with connectivity issues, so that they could make the telehealth experience as smooth as possible. I think this is a great idea. As a naturopathic doctor, I kind of work in a smaller clinic, but I did spend some time in the beginning helping patients try to get logged into whatever video consulting service we were using at the time. or sometimes our staff were doing that. So that was an adjustment. So I thought that that was great. And I do think that if we're going to continue with telehealth, we should have programs like this, or even with helping patients get logged into their portal so that they can stay connected with their doctors, look at their lab results and everything. So I really liked reading that this was happening. So currently, if you look to see what Medicare is thinking of for telehealth coverage now, it says that permanent changes are that Medicare patients can receive telehealth services, including audio only for mental and behavioral health care in their homes if certain conditions are met. The website doesn't specifically say what those certain conditions are, so I couldn't include those. Then what is being phased out? So at the end of the 151-day waiting period, basically there was some flexibility regarding, where patients were, where the doctor was, and I think that there isn't going to be as much flexibility with that anymore. Like if the patient should ideally be in the state that the doctor is practicing in. So I think there's some flexibility around that, and they won't be quite as flexible anymore. With mental health telehealth services, in-person visits will be required 6 months of an initial assessment and then every 12 months afterwards. Medicare reimbursement for physical therapists, occupational therapists, speech pathologists, and audiologists will no longer be allowed. Medicare will no longer cover audio-only visits for physical health encounters. And then this one here, sorry, you guys, my notes on what all these stand for keeps disappearing. But basically, Medicaid and Medicare may not reimburse distant site telehealth providers for non-mental health services. So I thought that was interesting. Usually, as we know, private insurances follow what Medicare and Medicaid do. Oh, and so I have it now. I apologize for the delay. Rural health clinics and federally qualified health centers. So that's what those two stand for. So then this is just a quote here from another PubMed article that I found. I think kind of just sums up what the future of telehealth, what we kind of need to be doing if we want to incorporate it more. Patients and conditions where telehealth may yield the greatest benefit, or clinical services are not suited to virtual care. I completely agree with this. I really hope that telehealth stays for some conditions. I think that other conditions like skin conditions, really hard to see someone's skin sometimes with telemedicine or telehealth. Digestive conditions, can't really do an exam for those. So I think that hopefully there will be studies to determine which conditions, maybe certain diagnosis codes are okay to use with telehealth and which ones are not. And resources can be found on this slide here. And that's the end of my presentation. All right. Should I just close out of this, or does someone have a question or want to go back to a slide at all?